What should you do if you notice you've got white spots on your teeth during orthodontic therapy? Well, this is a potentially worrying thing. It's a pattern of decay that tends to be specific to people who are wearing fixed appliances, the railway tracks of orthodontic appliances. Having anything glued to your teeth tends to encourage debris to build up around the teeth, and it makes it more difficult to clean your teeth. And this allows these white spot lesions. Effectively, what's occurring is that the acid produced by the bacteria consuming what you're eating slightly or lightly dissolves the surface of the enamel, the ivory that the tooth's made out of. And as that surface becomes dissolved and the mineral leaves it, it goes this chalky shade of white. Now, if this is left and gets worse, it can make some rather nasty discolorations on your teeth that can be permanent. So it's important to recognize it early and act quickly. A good thing to do is mention it to your orthodontist when you go to see him. All orthodontists should take good quality photographs of your teeth before you have orthodontics, and frequently people have white spots before they embark on orthodontic treatment, so it's worth chatting with your orthodontist to see if you had these spots naturally before you started orthodontic therapy. However, if this isn't true and it's something that's been acquired since the orthodontic treatment started, you need to think of some strategies to preventing or possibly even reversing these white spots. Now, the most important thing to do is look at your diet. Look at the frequency and the quantity of refined carbohydrates you're taking, particularly sugar and fizzy carbonated drinks. Even the diet carbonated drinks still have a lot of acid in them. And it's the acid produced from the food itself and produced by the bacteria that are causing these white spots. So my top suggestion is you start by stopping all between meal snacks or drinks apart from water, so that between meals your teeth aren't subjected to any form of acid attack. Eat things like cheese or a glass of milk at the end of a meal, which helps stimulate saliva and also are quite alkaline, so naturally buffer the acid. And brush your teeth really well, particularly with tooth mousse. This is a product that's been shown that can reduce these white spot lesions. You might need to find that on the internet, or your dentists may have tooth mousse. I recommend you use tooth mousse before you go to bed, like a toothpaste. I'd also recommend you gargle with a fluoride mouthwash. Possibly have the fluoride mouthwash in the shower pan of your shower, so that when you go into the shower, you can rinse with the mouthwash in your mouth for a longer duration than would occur when you're standing in front of your mirror just after you've brushed your teeth, since you're not doing anything else with your mouth while you're showering. But focus on your diet, focus on what you're drinking, use some tooth mousse, use some fluoride mouthwash, maybe take a photograph so you can monitor it and talk to your orthodontist.